My name's Oliver. I work at Peter MacCallum Cancer Centre in Melbourne. I'm going to talk about the psychological impacts of caring for women with ovarian cancer. I've met lots and lots of cancer patients and their families and loved ones, and I think it's really important to have some time to focus on the loved ones of people with cancer, as the challenges can be really immense. What I'd like to do tonight is go over some of the common psychological challenges that people can experience when they're caring for women with cancer. I'm going to pay particular attention to anxiety and depression and relationship challenges. And I want to talk a little bit about the impact of COVID on some of these challenges. And I think most importantly, I want to cover just some strategies that can help to improve these issues if they come up, and also protect against them coming up in the first place. A lot of the time, the people I meet who play really prominent caring roles, they don't always resonate with the term carer because they consider caring for their loved ones to just be a normal part of their relationship, something that needs to be done and that they're happy to do. There are formal caring roles that people do apply for, but when I'm talking about carers, I'm really just meaning anybody who plays a caring and supportive role for the one that they love. A lot of the time this is spouses or partners, but sometimes it can be children or other close relatives or friends or neighbours. This is just an example of some of the responsibilities that carers find themselves picking up when someone they love is diagnosed with ovarian cancer. The one on the right, just so you know, is the social challenges and responsibilities. So I think most obvious are the medical responsibilities that come up around caring for someone with a diagnosis. These can be really complicated and really full on, as a lot of you might already know. The medical appointments that are involved in cancer can be almost a full-time job. And a lot of the time these are negotiated around other jobs and commitments. So just carrying the burden of all of the different medical commitments can be really overwhelming. And carers often pick up a really important role in managing these things. And then around the medical challenges, there's the practical challenges of needing to adjust a household or a family to having someone's role really significantly changed. A lot of the time, the carers are needing to pick up a lot of extra responsibilities around the home. And a lot of the time, these aren't really ever overtly talked about. They're just sort of naturally evolving changes in the way the house runs. And often people doing things that they've never really practiced doing before in the house. There's lots of emotional responsibilities that carers pick up to support their loved ones, not just the person diagnosed with cancer, but the people in the broader family or social network. They can have to reassure people a lot of the time, act as a cheerleader. They have to keep a lot of people informed about what's going on a lot of the time, and that is also an emotional burden, because often it's the people who are delivering the news who then need to sort of carry the emotional burden from the person who's being informed about what's going on. So this is just a few examples of a huge variety of responsibilities that carers often pick up. Now, in the same way that that was just a list of possible responsibilities, this is just a list of possible emotional responses. So I guess the take-home message I would really want everybody to leave with from this slide is that there's really no normal emotional response to someone that you love being diagnosed with cancer. There is shock, there is anger, exhaustion. There's really often a lot of fear, and the fear can often be covered up by other emotions like feeling really overwhelmed or irritable. Most people who are diagnosed with cancer, and most carers for people with cancer, are really, really aware of the uncertainty that's been cast over their life, and that carries a huge emotional burden. I think that the other important thing is that these emotions that people go through as part of a cancer journey can come up at any time. From investigating medical issues to actually getting a diagnosis, to getting a treatment plan, to following through it with a treatment plan, having plans change all the time. At every step of the journey, there are different emotions that can come up in response to these, and there's just no normal response. I want to talk specifically about anxiety and depression, first of all, because I think these are quite common, and they also cover a really wide range of experiences that people can have when they get distressed. When I'm talking about anxiety, I'm talking about a set of embodied feelings, and also cognitions and emotions, and also a set of behaviors that people tend to come up with. And so physically, when people start to feel anxious, they often feel tense or have shortness of breath. They can have sweatiness or shakiness. And a lot of the time when people are anxious, they feel pain, sometimes in their stomach, and they have nausea or stomach problems. I think one of the really central experiences of anxiety is worrying. And it's normal for people to worry, but when people start to feel really anxious, the worrying feels intrusive, and it feels like something that they can't actually stop doing. It can often involve a lot of feelings of fear and being full of dread or feeling overwhelmed. And people might compensate for some of these feelings by avoiding the things that are making them anxious, or taking an opposite track and getting really hypervigilant and looking for symptoms or looking for things that might be going wrong. So if anxiety is winding people up more and more and more, depression is bringing people down more and more. It often makes people have a lot of physical changes in their body. They might start to notice feeling much more sleepy or fatigued, or their appetite changing. They might notice changes in their sex drive. The thoughts that people have when they feel depressed are often quite scattered and muddled, or they find it difficult to concentrate. The thoughts can be really negative, but it's very often characterized by negative thoughts that are really critical of themselves, really full of guilt and self-blame. And a lot of the time, the behaviors that are associated with depression are to withdraw from other people or withdraw from activities that they otherwise would have enjoyed. And this is a real problem because it sort of creates a bit of a cycle where people will then miss out on things that they otherwise would have used to sort of cheer themselves up or make them feel a bit grounded. As I said before, carers pick up a huge amount of emotional and pragmatic burden when someone they love has cancer. And there are also, alongside all of those responsibilities that they pick up, there are just huge changes that happen within the relationship as well. So there can be a lot of changes to the roles that people tend to play within their relationships. And often, as I said before, these can kind of go unspoken. People are sort of just expecting themselves to make major adjustments to the kind of things that they would normally be responsible for day to day. And this can be really difficult, especially when they're things that someone's not used to doing. And because it's a lot of the time not spoken about, people can just expect themselves to perform just as well as they were normally performing in their life and in their relationship. There can often be resentment that comes up with this and tension in the relationship. And this is really difficult, especially because carers are, often really motivated by looking after the person they love. So when there is conflict, it can be really hard to acknowledge that. I think it's also really important to just acknowledge how challenging it is to take on a carer role where you're primarily wanting to help and support someone, but just feel exhausted or burned out and not up to the task sometimes. This is a really big burden that carers face, and it's really important to watch for anxiety and depression so people don't burn themselves out. And last year we had, and ongoing, we've had challenges of COVID, which have just absolutely magnified a lot of these risks because people are isolated and worried. That uncertainty that most cancer patients and most family members feel is magnified by the uncertainty of a whole society that doesn't really know what's going to happen next. And there is really magnified fears about the health of the people that we love. I think it's also really important to acknowledge that men who are caring for their loved ones face additional risks in that men are just taught a lot of the time to not seek support and not reach out for support, particularly about emotional needs. A lot of the men that I meet have been raised in their families and by society to be much more focused on solving problems and fixing problems rather than taking an emotional approach to managing their life and looking after their anxiety, looking after their depression. It's really discouraged a lot of the time for men in our culture. And so I think that acknowledging these barriers is also really important, because when we do become emotionally burned out, then we're not really capable of looking after the people that we love. And so looking after one's emotions is really important. So a lot of the time, that sort of fixing the problem approach is really difficult too, because cancer, and ovarian cancer in particular, presents a lot of problems that just can't be fixed. That's why I like this quote: "You can't stop the waves from coming, but you can learn how to surf." And I want to just give you some really quick tips on how you might guard yourself against things like anxiety and depression, and just correct them when they turn up. So when I talk about self-care, I'm talking about something that you really intentionally do, that you will make a commitment on a daily basis to do things that look after your own well-being. And the way that I like to frame this to people is to be able to make a plan to do at least one thing every day that feels like you've achieved something, and one thing every day that you genuinely enjoy doing. This is probably the first and foremost protective thing against depression. So we don't want people to neglect themselves. And I've put just some ideas of things that might be achievement and self-care, and things that people might find enjoyable. I think that looking after your health is really important, because a lot of the time when you're caring for someone with health problems, people will neglect their own health and well-being. So visiting a GP if there's something that you need to follow up on, getting exercise, making time to relax and wind down at the end of the day so that you can have a good night's sleep. And I think it's also important to acknowledge drug and alcohol use, because a lot of people can turn to these things to relax themselves, when it's quite healthy and good for our mood in the long run to make sure we have at least 1 or 2 days every week where we're alcohol and drug free. With anxiety, one of the really important things to do alongside those daily self-care practices is just be aware of the kind of thinking patterns that we have, and having a look for those moments where we're just ruminating over and over and over again about the same things that are stressing us out. These are some questions that you might ask yourself about the thoughts that you're having that are stressing you out. And the idea is just to try to bring in a bit of a balanced perspective about them. Some people find it really helpful to schedule some time to worry out loud, either writing or talking it through. And they find that if they do this purposefully, then they don't unintentionally ruminate about things later on. And another thing that you can do to break the pattern of worried rumination is to try and think of one action that you can take next about the problem that's going around and around in your head. And once you've got it, you can write it down and give yourself a reason to just stop going over it. If there's no action that you can take, that might be a sign that you can stop the rumination as well, because it's not actually helping. It may sound really weird. A lot of people find it really weird that I would suggest to schedule in times to have talks with your partner. But I think it's really important, because a lot of the time, especially in our closest relationships, we can spend heaps of time with somebody without actually airing the things out that we really feel like we need to talk about. Especially when caring for someone we love with cancer, it can feel almost guilty or inappropriate to bring up things that you might be having problems with in the relationship. But the longer that goes on, the more likely people are to feel burned out or resentful in the relationship. And so I think if you can schedule the right time to bring up the things that have been bothering you, there's much more chance in the long run you'll improve communication and well-being between you and your partner. And I also think that it's really important to schedule some time where cancer will not be the center stage of the relationship, and people can do things without going over their medical needs, as hard as that might be sometimes. Very quickly, just want to acknowledge the role of grief in a lot of these things. I don't want to talk too much about anxiety and depression without talking about grief, because grief is an extremely natural response to loss. And I think that it's really important to keep in mind that grief is a huge part of coping with a diagnosis, because so many things are lost in that process. It's not just death, but also aspects of a relationship or future plans. And also grief can come up in a way that is anticipating a loss as well. It's really upsetting. And most of the time, the way grief works is that people need some time to focus on the loss and then some time to do things that are called restoration orientated. It means that they're building their life up and adjusting to something new. And grief often works where people will bounce between these two different states, focusing on the loss and feeling the emotional distress of the loss, and then doing things that move their life forward. So I've given, I suppose, a really broad and surface level coverage of these things. And I would really encourage you to seek some support and get extra information if you feel like any of these things are relevant to you and you want some extra focus on them. You can do that by going and talking to a GP. There are excellent support groups available that you can look up. You might organise to see a psychologist, or if things feel really unmanageable to get out and go and organise those things, there are support lines that you can call up to speak with someone about it and make a bit of a plan. And that's my talk. Thanks very much. Happy to take a question if we do have time.
Thank you so much, Oliver, for providing us with all that valuable information. We do have one question from the audience. Can you give some advice around fixing sleep problems? Yeah, sure. Sleep problems are really, really common for people with a diagnosis and also people caring for them. And I suppose the first thing that I want to say in response to that is that they're really normal, and it's quite normal for people to have like little phases of their life where their sleep's disrupted. Over the long run, though, we want to have good behaviours that just tip our sleep in the right direction. I think probably the biggest issue that I see with people is having expectations that they will be able to do really stimulating or stressful things and then just switch gears straight away and go to bed and go to sleep. Most of the work that I do to help people correct sleep problems is about them setting up a really nice routine where they can slowly wind down over time and do relaxing activities until they're ready to sleep. And for someone having sleep problems, I'd really recommend looking into some relaxation strategies like breathing strategies or muscle relaxation strategies that help people wind down much faster. And there are some good apps to help with that. Like I use the Calm app to help me when I want to wind down. I think a lot of people use Smiling Mind and things like that. So you can find some good apps to help with those relaxation strategies. Great, thank you. Great advice. Thanks again, Oliver. We really appreciate your time.